He's one of the hardest working people that I know, and it's an extraordinary privilege of mine to be able to work with him. He has a great resume, but he's asked me not to share his entire resume. So suffice it to say, he is the recipient of many awards and recognitions. This includes recognition of his combining professional practice in architecture and urbanism with teaching, scholarship, and academic administration into a career that celebrates design thinking, multidisciplinary collaboration, and the constant exploration of digital technologies in design and education. He is a passionate advocate of the critical mission of the liberal arts in the 21st century and its key function in educating our future leaders. He's used this passion to renew the passion of so many of us LES alum. And he's the architect behind the re-envisioning and rebranding that you see on the display of LES. His constant focus is on innovation and on seeking new opportunities for the college. So without further ado, I have the privilege of presenting Dean Guillermo.
Thank you so much, Mitch. That's a wonderful introduction. So kind of you, so generous. If you can send me that in writing, I need to pass it to everyone introducing me in the future. Thank you so much. And thank you everyone for joining us this late afternoon, early evening for an update on our college and of course a very interesting discussion panel by some of our most distinguished faculty. Thank you for joining us. And as a framework for our update in the college, our college, I just want to kind of create a little bit of that scaffolding in the sense that, of course, we are all familiar with the understanding that we are at DePaul. And at DePaul, we respond to the Vincentian question, what's to be done? We all heard that. And of course, our university has replied to that Vincentian question by saying, here we do. And if you have been or are in Chicago, you saw the ads, you saw the billboards, you saw the bus stops, the trains, all celebrating that tagline, here we do, in response to the Vincentian question. Now, of course, this is not just a tagline. And we have put great effort on connecting that with the reality of who we are. And you all as alumni and friends of the college know that is very real. It's not just a bumper sticker. It is very real. Here we do. And one of the ways in which we do that is by being experiential. Many schools out there say that are experiential. We are, I think, in a very special way, not only because of our long standing of experiential learning as a graduation requirement in the core curriculum of the university. For the last 20 years, we were one of the very first ones to introduce experiential learning as part of our DNA. And of course, we're well known for service-based learning. But we are also heavily engaged in project-based learning. And the way I explain this frequently to our students is that most schools in the liberal arts and social sciences establish awareness. Many of our students bring it from high school, actually. We build on understanding on top of that awareness. That's what liberal arts does for us, understand the world out there. But we at DePaul go beyond understanding, and we become actionable. We are activists. And we do that by nesting, in many instances, projects inside our courses. So it is based on that connection that I always explain that we go beyond that tagline, and actually that relationship of our mission, our vision, and our students is connected. That distinctive mission and vision is translated in very distinctive graduates. All of you give back, all of you do, all of you are impactful. And it's because of that secret sauce that is that experiential learning component. But of course, these are things that happen because we uh, uh, invest in a structure that facilitates that and programs that facilitate that. So as an example, I'm just going to mention three that perhaps are in part new to you, because two of them have evolved pretty recently. First, of course, many of you are aware of our School of Public Service. This is one of three schools now in our college. Until recently, it was only one. Now we have three. And our School of Public Service has the largest congregation of graduate programs in our college, and brings together also now an undergraduate program in public policy, which before that was not directly related. And it brings a center to what we call the Urban Studies Collaborative, which is an even larger collection of programs that understand the city, understand Chicago as the cultural construct it is, a lot more than just brick and mortar. So we have the School of Public Service that is doing fantastic work at this time, bringing in resources that are critical for the research work they do and the teaching. But also recently, if you heard and read from our magazine, we have the Gray School of Applied Diplomacy with an undergraduate and a graduate program in applied diplomacy, diplomacy for the citizenship. And recently was awarded by an anonymous donor $20 million endowment that is allowing us to take the school to the next level. Furthermore, and only weeks old, we have the art school at LAS, at DePaul. Before, it was known as the Department of Art, Media, and Design. This is a school that is by nature a Vincentian construct. It is the only art school in the city that provides admission to students without a portfolio from high school, which is very important if we want to recruit from schools that perhaps don't have an art program, but with students that are extremely talented. It is, as Mitch would say, a very DePaul thing. The art school at LAS. And you will continue to hear a lot more about our schools, our departments, our programs. LAS is driving, and it's extremely exciting to see the things that are happening. Now, of course, we see what's happening right now, but we need to keep our eye on where we're going. And here you can see the skyline of Chicago, early morning, as I drive early in the morning when I used to, when I had a commute. Now of course, we're all virtual in one way or another, but it is very important for us to see where we are going. And in that context, we have been meeting with our advisory board, and here you can see some of them at work. You can see Mitch there next to the whiteboard, where we have been working on the things that will help us in the future recognize our alumni, things like a Distinguished and Outstanding Alumni Award program, things that will allow us to develop, share, and develop events, like for instance, an alumni symposium, the opportunity of connecting our alumni with our students under a program for alumni connectors, and of course, the ability of our alumni to give back, something that I know everyone in our community is always happy to do. So as we move into the future, and it's a kind of new future, as you can see by the title below there, it's about the opportunities of a new normal, something we don't know, and probably we are going to be talking a little bit about this evening. We see, of course, many opportunities. And we're very excited about the level of online teaching that we have developed in the last few weeks. We have accomplished probably in 4 weeks what otherwise would have taken 5 years to accomplish. So you can see a number of opportunities that we're trying to connect, but also you can see some challenges. Of course, there is great uncertainty of how we're going to continue to move forward. But one thing we know for sure is, as you can see here in the screen, our students are going to be in great financial need. And that's a big question we have. How many of our students are going to be able to come back to continue to study with us? How many new students are going to be able to join us? We know that there's great hardship out there in the financial side of things. So now more than ever, we need the help of everyone. Everyone is pitching within our community. And I just want to let you know that the same way as you saw the opportunity to provide assistance to our students when you registered for this event, on the follow-up of this event tomorrow, you will also have an opportunity to help us, help our students to continue to drive, continue to study with us, and fulfill our mission, which is, as you know, it's a mission of access. So with that, I would like to open it to questions that our family, our LAS family may have about our college at this point in time, our updates, and we'll put perhaps 4 or 5 minutes into it before we switch into the main event of this evening, our discussion panel. Thank you.
Hi, everyone. If you haven't had a chance to ask a question in the chat, please feel free to do so. I'm Margaret Story. I'm Associate Dean in the college, and I'll be helping Guillermo with those. If you have a question, do pop them in there in the chat. I don't see any yet.
Any questions? Oh, wow. I was crystal clear. I was told I do that. Apparently, I do that.
Here we go. We have one. There's a question about how do you understand the future of higher education right now? Is it just any thoughts on that in general?
Mm-hmm. I think that, of course, everyone would like to have a crystal ball and figure out what is in that horizon. Would be extremely valuable to know. The truth is that we don't know. All we can do is formulate perhaps educated guesses. One thing that we can say in that context is that people are going to have a different level of access to higher ed through virtual means. Most colleges had, I would say, what we consider to be significant online programs. DePaul had about 20% of its portfolio online with very high standards. But the process of building that 20% took years. And now we are 100% online or remote. And that has been a huge difference. That's making also our market of students out there a lot more technology permeable. People that in the past were not using Skype or GoToMeeting or FaceTime now are using Zoom. And that's something that is going to stay with us. Platforms for telepresence, video conferencing are going to allow us to deliver in geographically distributed ways, in asynchronous ways, opening a complete new horizon in terms of access. Time and space is not going to be a limitation anymore.
There's another question, which is more, it's a little bit on that same thing. It's very much specifically about the President of Brown's call for students to return to campus. Do you expect that to happen at DPU?
Mm-hmm. We would all love to go back to campus. As you know, we have, 2 beautiful campuses, very distinctive with a lot of personality, where a lot of things happen in, I would say, very informal, very unscripted ways. And we all love that. Of course, we need to make sure that it is safe to go back to campus. Right now, when our students look at their rosters for registration, they would see that most of our courses are coded with a time and a place in one of our 2 campuses. as an expression of what we hope. But we all know that hope is not a plan. So at the same time that we hope to receive our students in campus, as we always do, go back to normal, and I know that everyone would love to do that, we're also planning to be able to deliver online and through remote. So what we accomplished very quickly last quarter, we will be ready to accomplish again if necessary. So we're looking at what may be the circumstances. We can assume that some classes will be in campus, those that are very difficult to deliver online. A growing number of classes will be probably online and remote.
Very good. There is another question that I don't think we have quite time for. There are two more questions, but we'll follow up if we can get those back into an answer. One is about what have we seen through remote learning that's been exciting, but we do need to turn to the panel now. Our time is up. And there may be another opportunity towards the end if we get a chance.
Absolutely. Thank you, everyone. Thank you, Margaret, for facilitating our Q&A. And now it's my pleasure to introduce three faculty members that are associated to our Urban Studies Collaborative. They are also associated to the Center for Community Health Equity. And they together can provide us with perhaps a better understanding of what is in the horizon, what is in our trajectory, in our path as we move forward. So looking at the path forward, I would like to invite them first to introduce themselves and then to take this conversation forward. So I'll start with inviting Suzanne to get us started.
Thank you. Can everyone hear me well enough?
Mm-hmm.
Great. So I'll just do a quick introduction. I'm an assistant professor in the Master of Public Health program at DePaul. I also do quite a bit of community work as director of research for a community-based organization called the Chicago Recovery Alliance that works with individuals who use substances and people who are precariously housed or homeless. Do quite a bit of direct public health work there and a lot of research collaborations. And I teach across the curriculum.
Hey everybody, I'm Fernando De Mayo. It's a real pleasure to connect with you today. And it's particularly nice to see lots of former students on the tiles here. I see your names. I wish I could call on you for questions, but it's not that kind of class today. So I'm a professor in the Department of Sociology, and since 2015, I've had the pleasure of serving as the co-director of the Center for Community Health Equity, which we operate between DePaul and our colleagues at Rush University Medical Center. The center has about 35 affiliated faculty on the DePaul and Rush side, anthropologists, sociologists, public health, working together with doctors and nurses with the idea that together we do things that we wouldn't do by ourselves. The other thing that I would mention in my introduction is that thanks to the willingness of DePaul, I'm entering into a joint appointment where I will remain a DePaul faculty member, but I will also take a role of the American Medical Association, becoming Director of Research and Data Use in their new Center for Health Equity. So it's a pleasure to connect with you today, and I look forward to the conversation. And I'll pass the baton to Noam.
Hello, I'm Noam Ostrander. I'm an associate professor in social work, broadcasting from Cortelyou Commons, it seems, my green screen. As I mentioned, I'm a professor in social work. I'm also the the director of the Chicago Gun Violence Research Collaborative. And sort of on top of that, I think as probably all social workers do and everybody on this panel represents that sort of tagline of here we do. I do a lot of work in the community and a lot of work seeing clients right now who are very much affected by the shelter in place and by the coronavirus as well. So I'll pass this on to Dan.
Hi, everybody. Good evening. My name is Dan Schober. I am an assistant professor in the Master of Public Health program. And I am also have the privilege of doing a lot of research out in the community. My research looks at health disparities, specifically those related to chronic disease and violence. I've also been involved in the Chicago Gun Violence Research Collaborative. And I've had the privilege of getting to know and getting to work with many communities of color on the west side of Chicago who've been disproportionately affected by the COVID-19 outbreak. So I look forward to tonight's conversation.
Great. Well, I get to kick us off with the first question, and it is to Suzanne. Suzanne, what has this crisis revealed about the structures of public health in the United States? Is the crisis prompting any wholesale changes anywhere that might provide a foundation for new approaches in the future?
Thanks, Fernando. It's such a good question and something I think those of us in the public health field have been thinking about and talking about continuously for the last couple of months. In trying to organize my thoughts, in sort of a succinct way, I actually did a SWOT analysis today to think about things that I think that have happened that are strengths, things that have been weaknesses in our response, threats, moving forward, and then also opportunities for us to work and manage both the existing crisis and, as we move forward, being a bit more prepared for future things that occur. And so I'm actually going to share the analysis on the screen and just briefly walk through it. If the screen share works properly here, 1 second. I think we got it. Great. Okay, hopefully, can everyone see that? Yeah, I see a few nodding heads. So I was really thinking about strengths, and I think our strengths have largely been people. Our strengths have not been our systems. I'm just going to be quite honest about that. I think we largely have underfunded and our public health preparedness response. We haven't had incredibly strong infrastructure, but what we do have are incredibly passionate people who've acted with purpose. We are lucky to be in a state where both our state and our local leader here in Chicago have worked collaboratively, have made incredibly difficult decisions in a high pressure time to do what's best for public health and to choose people over politics, which I think is a really powerful thing for both our state and our city. But they've largely done that without significant federal support. I think in terms of strengths in the federal response, we've had a few things. One notable one for me, because I work with people who are using substances, is there was a lovely quick response sort of move medication-assisted therapies federally to help interrupt the incredibly burdensome structure and allow people access to their medicine. So there have been some federal things that I think have been done well and quite supportive, as well as now a push to move for folks who are uninsured to have access to COVID testing. And that's exciting as well. But I think largely our response has been outside of these sort of moments of leadership, it's really been people who've worked in healthcare and people who are working in the community who are responding, and they're responding largely without appropriate stock of PPE or equipment or things in place. We have amazing activists in the public health community who are fighting for things like release of folks from corrections, where we have an incredible amount of infection happening. And then we have this beautiful, I think, largely invisible majority of folks that most people, I think, have underappreciated, and that's all of our service workers who are helping to keep us all stocked personally as we shelter in place. So I think our strengths have largely been about humans, and happy to sort of talk about that passion and the purpose that's drawn those folks together. I think where we struggle has been, we've had a lack of federal leadership and a lot of misinformation come from federal leadership that has caused confusion in the public. That has been something we've had to contend with. We typically have less than 5% of our federal budget that goes to prevention related things in public health. Most of our health expenditures are related to care. And so if we think about ways in which we could do this quite differently, being properly prepared and having more of a public health response, if we had better infrastructure, if we had more resources, would definitely have been something that would save our healthcare workers from having to make incredibly awful decisions about equipment and being, sort of not properly stocked. I think that this has largely illuminated how inequitable our systems are in terms of healthcare and housing and other differently, and that there are some of us who are well positioned to survive the pandemic, and other folks who will have significant barriers to achieving what they need. I have been talking daily and getting very angry about the lack of access to testing. Basic public health response, we should have had testing available in a ubiquitous way. We should be doing contact tracing. We should be out boots on the ground. And I think those things are starting to happen now. And the fact that we've gone this long without that happening has been upsetting, right? From a public health person who's done that kind of thing for other viral epidemics, that's really been quite disappointing to me. And then we had a lot of sort of ambiguity or delayed prevention messaging around the use of masks that I think we're trying to resolve now and work on now, but that could have been far more proactive. I'll just highlight a couple of threats. We're still very care focused, and now we are care focused in a dwindling resource environment. And so really highlighting what we need for public health going forward is really important, as well as combating the myths that are out there, really talking about why we do the things that we're doing from a public health perspective to save lives. And in opportunities, I think we've seen a lot of innovation that's been exciting. I'm seeing an increase in critical consciousness about health inequities. That's quite exciting to me. I think this is an opportunity for us to re-examine our values and what we need in leadership nationally and in public health. I think it's also an opportunity for us to broaden our perspective on what is an essential worker and how much we value people who contribute to a variety of things that support our lives. And I think an opportunity is that I work at an institution that has a Vincentian mission, and so my work is well situated to fit in this, as are all of the people on this webinar, which is exciting. We've got folks who are interested in being able to do something that's a community response. So I will leave you with many of those thoughts. This could have been a much longer list, so I really did hone it in for you. But I would actually love to flip to Fernando and ask you, how has COVID-19 illuminated the power of poorly collected or poorly analyzed data to reinforce racial inequities in our society and healthcare systems, to limit our understanding of the disease? What are experts doing to address this, and how can improvements be sustained so that we can begin to break that cycle and have the data work to help us? I'm going to stop my share. Hang on one sec.
Great. Thanks, Suzanne. And a really lovely analysis that you laid out. I'm also thankful that you didn't have an endless list of threats, because there are many, many that we could go into. But it's good to balance it out with the opportunities as well. And thanks as well for the thoughtful question. As you know, all of my work as a sociologist has really been guided by a very basic idea that we call radical statistics, that we can do statistical analysis to not just describe the world, but to change it. And doing that requires good data. And the COVID epidemic has shown us what goes wrong when we don't have the right data, how quickly messages go awry if we don't have the correct information. All of my work also revolves around the concept of structural violence. And I think that is also very relevant to understanding the COVID-19. right? Structural violence, it's a concept that emerged in the 1960s and popularized most recently with the work of Paul Farmer, an infectious disease doctor who worked in Haiti for most of his career, fighting tuberculosis and HIV, but it's relevant here. Right? Structural violence are political and economic arrangements that harm populations. They're structural because they are embedded in the organization of our world, and they're violent because they cause injury to people. And the injury in this case is real death, right? The suffering, parental suffering and premature mortality that we all want to avoid. So on the data side, I think one of the things to point out is that at first response, the system wholly ignored the racial and ethnic patterning of the burden of this disease. If I can share just a couple images from my reading of the literature. The very first wave of messaging that came out was that the virus doesn't discriminate. Even from the World Health Organization, an institution that I very greatly value and would suggest that we give a lot of money every year. Even some of their messaging was that vulnerability is universal, right? That we live in a globalized world, interconnected, vulnerability is universal. But I think what we're seeing is a story that is heartbreaking, right? Because it repeats, it's an echo of stories that we've seen with cancer and heart disease and diabetes and Alzheimer's disease and infant mortality. That disease follows the fault lines of inequality in society, right? It is not an equal opportunity. It follows the social divisions that we have. I'm very grateful, I think, for the great wave of journalism, amazing op-eds and editorials in popular magazines and newspapers, and now starting to trickle in as well in medical journals and social science journals and others, highlighting the need for this data. So in the piece on the top left from the New York Times, the pandemic's missing data, we desperately need to release the statistics on race and ethnicity. The piece on the right said that being a person of color isn't a risk factor for coronavirus, living in a racist country is. And that's a very important part of the story that's beginning to be told, right? How do we understand the causal chain from exposure, risk, and outcomes? And that also mirrors stories that we've been telling for a long time in health disparities literature about the social patterning of disease, the structural and social determinants of health. So this fundamental story is not about biology. This story is not just a medical issue, right? It's a social issue. It's a social inequality issue. And it's not a story that's explained away by pre-existing conditions, right? It is not that African Americans have higher rates of diabetes and obesity, even though in many parts of the country they do. What we ask in public health and in other critical disciplines is we always ask why, right? When we go why and why and why, and we track upstream to the fundamental causes of these inequalities. And that's where we come to these structural and social determinants of health that structure our access to the healthcare system, that structure our access to income, to job security, to food security, and stable housing. I think to break the cycle, right, we need to name and fundamentally understand that underlying problem, right? That it's not a medical virus that we're fighting a deep inequality problem in our society, and not just in our city. The signs of hope for me are partly emerging from Chicago. On the left, you have one of the latest maps that our colleagues at the Public Health Department have published looking at death rates from COVID by community area. There are slight wobbles. It's not perfectly aligned with the asthma and life expectancy map, but it's concentrated in the south and west sides of the city. By and large, the map isn't that different than what we see with low birth weight and infant mortality. Those conditions we've unfortunately accepted, right, as unequal outcomes that are going to get distributed in our society. One hope is that this outbreak, by being such a breaking point, might get us to reevaluate those outcomes as well, right? So we will no longer find it acceptable that some communities have infant mortality rates that are 3 times as high as other communities. And on the far right, you have, I think, a very appropriate step, right, of community engagement, led by the Racial Equity Response Team from the Mayor's office. Let's try to marshal collective action, marshal community assets and existing relationships to address the public health underpinnings of this pandemic. So unfortunately, I don't have any easy answers. And my key message is that the story is complex. And a vaccine is not necessarily going to solve it. I would point out that we've had effective medication against tuberculosis for more than 40 years. That is still one of the major worldwide killers. I, like all of you, desperately want a vaccine for this virus, but it won't be the end of the story. The underlying story is inequality that's around us. All right, and with that, I get to pass on to the next question, which is to our colleague Noam Ostrander in social work. Noam, the impact of the crisis on mental health is another area we need to consider for frontline health workers, for families whose loved ones but cannot be with them, for people isolated at home in unsafe situations, fending for themselves. What innovations have mental health care providers made to try to mitigate this burden?
Mm-hmm. Thank you for that question, Fernando. You know, it's difficult because we see sort of daily sort of an onslaught of numbers and of trying to understand, you know, whether it's number of people who have died, number of people who have been infected, sort of various other numbers. But the thing that we're not going to know, one of the things we're not going to know for quite some time is the impact on mental health, right? So we know, perhaps, you know, most of us have felt that sort of anxiety of when is this going to be over? When's that going to stop? But, you know, it's so unclear, especially if we think about frontline healthcare workers. You know, we can see that there are concerns and anxieties about whether or not they get infected or the fear of infecting their loved ones. But as Bruce Swartz, who's the president of the American Psychiatric Association, said, that unfortunately medical professionals of today are going to be the patients of tomorrow, meaning in sort of mental health realms. And I think right now, as folks are in crisis mode, it is just sort of let's do the job and we'll get to that. You know, my hunch is that we'll be seeing that for a long time. And I think this sort of jumps ahead, I think, a little bit, but you know, one of the things that will help is going to be this COVID-19 oral history project that, you know, we've put together. So there are 3 colleges from DePaul involved. Rush University Medical Center is involved as we collect oral histories from frontline healthcare workers. I think that that's going to help us start to understand what some of the mental health challenges will be and needs will be. You know, and I think overall, and I should have started with this, really, the mental health aspect is going to hit different communities very differently, right? Like the folks that I am seeing as a therapist, you know, I'm seeing a large uptick in PTSD symptoms for people who have PTSD. And I think some of that is you know, this sense of unpredictability and the sense of a lack of control, that really sort of mirrors some of those traumatic experiences that folks have experienced in the past, whether it's been an assault of some sort or abuse that they've suffered. And if we think about, you know, part of your question was people who are sheltered at home in unsafe settings. If we think about intimate partner violence, I think at the outset of this, the assumption was that we would see an uptick in domestic violence, and it seems like that is been the case in Chicago. There's been a double-digit increase in domestic violence within the city. Part of that is, and part of the things that make this so dangerous, is that you know, as you're being sheltered and you can't sort of get away from your abuser, that's an issue. And I think that's probably also a reason why it's an underreporting, because if folks are stuck at home, it's hard to make a call and get out of that. And I think, and this sort of goes to Suzanne's point about, I think this has shown some stresses in our systems, right? If you think about shelters, domestic violence shelters or homeless shelters, how do you house people in a way that keeps them healthy as well as safe? And certainly, you know, Maher Lightfoot has talked about this and has put together a collaboration with Lyft and Uber to allow people to get sort of a free ride to a shelter that may have beds. But again, this is going to be something that we are trying to figure out for a while, and the state has invested or has made a commitment to invest $1.2 million in figuring out how do we improve domestic violence shelters across the state. And it's going to be a challenge. And again, I think that from sort of a social welfare perspective, I think there's going to be a big challenge to our systems through this. Again, whether it's homeless shelters, services to people who have been abused in their home or whatnot. And of course, the other part, and this is a large part of the folks that I'm seeing, because when this started, because I'm also a musician and I play in a lot of bars that have been shut down. I set up sort of an inability to see clients for free who might be in the service industry and whatnot. And just sort of thinking about the changes that will happen to the service industry and bars and restaurants and what that's looking like. And I have a few, restaurant owners who are worried about losing their restaurant and losing other things that go along with that. So I think that this is all part of that. I think it's all part of that anxiety and that depression and the stuff that we're not going to know about for a long time, even as we are sort of, I think, maybe daily or weekly shocked by leadership or statistics. There's going to be so many heartbreaking things that don't happen until after. I have one client who can't get home to a parent who's rapidly declining in health, and it's terribly sad to sort of think about how that goes through. But again, I think that we'll sort of overall be seeing and feeling the effects on mental health for quite a while after the pandemic passes, and sort of seeing what that imprints on our consciousness as we move forward. And so I want to turn now to Dan, and my question as I'm looking off camera here. So, we can become very focused on our city and on the United States, but this is truly a global event. What does it mean to have nearly every place on Earth impacted by the same disease at nearly the same time? What do you see in the world that is most encouraging and that causes you the most concern?
Yeah, it's a great question, Noam. Thank you. You mentioned mental health issues and trauma. I think that there's a collective sense of uncertainty, a collective sense of fear and anxiety. And, we're all experiencing this together throughout the world. I do have a visual here to bring up. Let me just bring that up. What you see here is just kind of a world map, and it kind of depicts different cases throughout the world. And you can see they're all over. It's affected 185 different countries and territories and places on the earth. As of today, we have about 208,000 cases. 208,000 deaths and over 3 million cases. So really, it's the whole world going through this together. I think the question's a good one. What does it mean? I think that it means two things. I think it means that we as a global community have to learn together. I think it also means that we have to collaborate together. Let me just kind of comment on each of those. Fernando mentioned the World Health Organization, and I share respect for the organization. They've put forth a couple key approaches to try to address and fight COVID-19, and they're all social in nature, right? We need to quarantine people who have the disease. We need to try to distance ourselves to prevent the spread. We need widespread testing. Suzanne talked about the importance of testing, and I think a lot of people are as outraged as we are that testing hasn't been implemented in the US, and we need to start to do contact tracing, right? And so as we saw the disease start in China, we had to kind of watch and see what they were doing and what sorts of effects it was having. The disease quickly spread to other parts of the world, to spread to Europe, and it spread to other parts of the world. And we had to kind of watch and see what did they do and what sorts of effects do they have, since we have no vaccine at the moment. So I think that we've already learned a lot from each other. We've had countries that have done really good things and were able to kind of contain the disease. South Korea is one example. We, unfortunately, are an example of what not to do. We had a slow response. We have not been able to get the testing issue down. Other countries have also had responses that have been inoptimal. United Kingdom hasn't done very well, Sweden, for example. So we really are in a position to learn from each other, try to implement the guidelines, and really kind of see what happens and what seems to be working. I think that's the learning part of it. The second part is collaboration, and I think that collaboration is incredibly important. When the disease broke in January, China shared genetic data on the disease. I think that was incredibly important to start to get research happening. There's a number of clinical trials happening trying to find a vaccine. That's really important work. It's happening here in the United States. It's happening in Germany. It's happening in the United Kingdom. There's trials happening in China. And I think right now there's a spirit of collaboration where we're not trying to develop and profit from this, but really share that knowledge and make sure that together we move forward. In terms of your other part of the question, Noam, you asked what was most encouraging and what was most frustrating. Let me start with the bad news, and then I'll go to the good news. What's most frustrating, what worries me the most, is that we may forget about the importance of funding and preparing for COVID-19 and other infectious diseases in the future. In 2017, I had the chance to do a study where I interviewed 23 leaders at Chicago-based nonprofits and foundations. These were executive directors that deal with health issues all day. And I had them, as part of the study, rank order 10 areas from the city's health plan, from most important to least important. And what they saw is the most important, and this happened in the later half of 2017. They saw violence as the most important problem. They saw economic development as second, and they saw education as third most important. What they saw as least important, number 10, was infectious disease. So this to me, it says a couple things. One, it says that when you go through a period of time without a major outbreak, infectious disease really falls in priority. Not to say that violence and economic development and education aren't important, but infectious disease fell really quick, and you kind of see the graph there. This was reverse scored. So infectious disease was not only 10th, it was 10th by far. So I think that once we get past this, I think that it will in fact shape a generation in how we think about health and public health. But I do think there's a risk of forgetting about the importance of this, underfunding the public health systems that Suzanne talked about that really need to be funded to address the next pandemic. And I think that there will be a next pandemic, maybe in our lifetime, but certainly a next pandemic. The other thing it says, this graph says to me, is that some of the really important priorities, at least here in Chicago, economic development, for example, is really had to be put on hold. And it's very extreme right now with things shut down. We really will have to work very hard to get back to where we were prior to the outbreak. So economic development, violence, Noam talked about a little bit. These are really important things that have had to be put on hold. So we've been kind of set back by what this disease has done to us in so many different ways. Now, what's most encouraging? The good news. The thing that I find to be most encouraging is I think the public really sees the importance of social distancing. The public broadly understands. And I can't think of many public health initiatives where the public understood to this level. And I'm really moved by that and the broad, widespread understanding and collective action. We see this on all levels. We see this from our federal lawmakers. It's obviously been very tough for them to come to consensus on anything, and they were able to pass large pieces of legislation to really start to address the issues and the problems that COVID-19 has brought about. We see this in industries that have been competitive with each other for their whole existence. have come together and really worked together to try to bring protective equipment, ventilators, and other things, and I find that to be incredibly encouraging. We also see this a lot with our frontline workers. We see a new and renewed appreciation of our frontline workers. And I'm just going to mention one group that's essential and really important, and that is those who are home healthcare workers. Home healthcare workers, there's about 3 million of them in the country, in the United States. The majority of them are women. About half of them are people of color. They make on average $12.71 per hour. Many of them don't have health insurance themselves. And I think with this outbreak, we've had a renewed appreciation of people like them. My hope is that this appreciation will continue and we will treat them better and treat them the way they deserve to be treated. So I'm just very encouraged by the togetherness and the collective effort to try to prevent and stop the disease. I'll stop there and just turn it back over to Fernando, and he can get us wrapped up here.
Hi there. Can you hear me? Dan, can you just take your screen sharing off a little bit there?
There we go.
Thanks so much. I actually thought I would poke my head in here. We're running a little bit short on time, and I wanted first to just see if our audience might be able to stay with us for another 5 minutes. I really want to give a chance to ask our panelists a few questions which have come up through the chat. And first, also, I want to just say thank you to you all. I mean, this is just such a privilege to be able to hear your points of view and your perspectives on this, and I think everyone would agree. There were already a couple of questions that came in. So could I just ask this in general? One person said, in a society that has a tendency to blame people for their own illnesses, how do we combat the eventual narrative that people who sicken are those who have failed to socially distance? Anyone want to pick that one up? Fernando, I'm going to call on you then.
Yeah, I'm just finding my unmute button. What a very thoughtful question. And yeah, you're right. There's a great deal of blaming, right? That happens under normal circumstances, and certainly will happen under these circumstances of COVID-19. How do we overcome that? There's no easy solution, right? And I fear that I am slightly pessimistic that we're not going to see our better nature emerge in the coming months. There's lots of collaboration and cooperation, but there's going to be a lot of division and a lot of blaming. So I think it's up to all of us, and DePaul has a great role to play in this, right? To contribute to societal discourse and try to elevate the conversation, right? That it's not that individual's fault for contracting the disease, and it's our public responsibility to help with treatment.
Right.
So that's going to be a fight for the years to come.
Yeah, that's where the kind of ethics, the public ethics, come into play in such an important way.
Mm-hmm.
Noam, this is a direct question for you, actually. Mm-hmm. There was just a question of clarification about Maher Lightfoot's investment and the $1.2 million. Is that in domestic violence centers just in the city or shelters in the city, or is it in the state? It's in the city, right?
Yeah, it's statewide.
Was there statewide initiative money on that too, or only in the city?
I think the 1.2 was actually not from Lori Lightfoot. That was a state
okay.
initiative.
I understand.
And if I can jump in just for a second on the blaming part, given that I do a lot of work on disability stuff, and I've obviously worked with a lot of folks who have were involved in gang violence and who have been shot and paralyzed, and so this issue about blame comes up quite a bit, and I think we see it a fair amount too, sort of in sexual assaults and whatnot. Mm-hmm. I think the difference will be shifting from a more individual spot to sort of a more sort of mass side, right? So like, I'll speak for myself, seeing the protests in Madison yesterday, the days all blend together now for me. There is a spot where, it's a bit of how can you you know, are you being irresponsible for that? Or if I go to the grocery store as I did today, and you know there are folks without masks, like what does that look like? I do agree with Fernando that I'm hoping for our better natures, but you know, perhaps we might not see those.
Well, that raises the question of the degree to which it's within our personal, you know, scope. Sure. to check those reactions and think those through.
Yeah. And mental health wise, sorry. And mental health wise, you know, one of the things that I am talking a lot about is focusing on what you can control and what you can't control. And you know, other people's behavior is always something that you can't control. Oh, but I could. That would be a lovely thing.
Absolutely. Well, there's one silly question that will wrap up our Q&A. Unfortunately, we want to give that last 5 minutes to the dean. And it is simply, who is the ghost over your shoulder, Gnome? Inquiring minds want to know.
You can't see it as well back here, but if I bring her closer. Stay home, save lives.
Yes.
It's Maher Lightfoot.
Very good. Well, thank you again. Maybe we could all have a virtual clapping for our panelists. Back over to the dean for some parting words.
Okay, now I'm back. As always, I make my best joke when I'm on mute, so I cannot repeat that one now. But I was actually thanking everyone in our panel for your participation. Greatly appreciated. Provided us with important information and understanding of the challenges, but also the opportunities. I'm hopeful. And of course, I also want to thank our team at the Alumni Relations Shop for all your help and support on putting together this event. We know it's not just a matter of waving a wand and making it happen. It takes a lot of effort. And of course, I want to thank our team at the Dean's Office, who thought about the event and started working on it with great enthusiasm to make sure that even if it's this way, we continue to connect, that we don't spare the opportunity to come together as a family that is mutually supportive all the time. So in particular, I want to thank Margaret, our Associate Dean, for new initiatives. And as you can only imagine in this environment, everything is new. So Margaret is being asked to do everything nowadays. So again, as always, Margaret, really appreciate all the effort and the hard work that you put behind our mission. And to close, I want to thank all our alumni and friends. You know, showing up means a lot to us, knowing that you are out there together with us and that you continue to do every single day, that you continue to fight for our students, provide for them. I'm extremely grateful for all your generosity coming to our students. As I mentioned before, tomorrow probably you will get a message, a follow-up, I believe with the recording of the event that will provide you another opportunity to give back to our students. And again, I want to underline how needy our students are at this time and how much we would need your help. Also, I want to, last but certainly not least, I want to recognize all our faculty and staff in the college and the university. What has happened here, it's just amazing. It's really inspiring, and I cannot say thank you enough, but I can maybe recruit you to do that for me. So if you remember that staff member or that faculty member that had an impact in your life, this would be a wonderful time to just send them an email saying hello, that you have been at the college event and you have remembered them and you know how much they are working to get our students through this difficult times. So I think it would be extremely valuable for all of us to hear from you always. And with that, good evening. Hope you have a wonderful evening. And again, until next time, maybe in campus, maybe in remote. But what's important is that we continue to come together. Thank you very much and have a wonderful evening.